Okay. Good afternoon, everyone, and welcome to our meeting for the Maryland Prescription Drug Affordability Board, July meeting. I'm going to call the meeting to order, and first order of business is the approval of the May 20 minutes that were submitted to you and also in your packet. Do I have a motion?
So moved.
And a second?
I second.
Okay. Any questions? All those in favor, aye?
Aye.
Opposed? No opposition. Thank you very much. Christina, is there any public comment registered?
There was no one registered for oral public comment. You did receive 5 written comments, which
Right.
are posted on the website, and then you also received them
Okay,
prior to this meeting.
and everyone got those, correct? Okay, next, under item 4 is cost review. And we're going to do some amended motions to our meeting, our last meeting, on exactly how we did to make sure that we are clear. So I'll entertain a motion on A.
So I move to amend the motion previously adopted by the May board meeting to do a cost review for the 2 GLP-1 drugs and the 2 SGL2 inhibitor drugs as follows. I move to strike the language for the 2 GLP-1 drugs and the 2 SGL2 inhibitor drugs and insert instead study of Ozempic, Trulicity, Farxiga, and Jardiance. And this is to clarify that although the board may organize or order the cost reviews by class or other groupings, each drug is selected for this study individually.
Okay, we have a motion. Do we have a second?
I second.
Second. I see Stephen's joined us. Afternoon, Stephen.
Thank you. I'm here.
Any comments for the motion?
No, I'd like to say why I think those 4 drugs make sense. Is this the appropriate time?
Yes.
Okay, so I'll start with Farxiga. I take a look at the level of gross spending. There's 2 products that are part of the cost review process. Both of them are in the top 100. One's 15th, the other 70th. You put them together, they're in the top 10. They're also high in the gross spending. They're high in out-of-pocket cost is Farxiga. They have it has a very high gross to net ratio, high percentage change in total gross spending, and high median out-of-pocket costs. So from Farxiga's point of view, there's a number of factors that would put it on the list. For Jardiance, it has 3 of the 4 products that they have in the top 10 gross spending, ranking 14, 18, and 83. You put them together and they're in the top 10. They're in the 2 of the 4 are in the top 10 gross spenders. 2 of the 4 are on the Medicaid claims. 3 of the 4 are in the top 100 in terms of out-of-pocket costs for commercial claims. 3 or 4 of them are also on the top 10 for Medicare claims. So you put them together, they're pretty much in the top 10. For Ozempic, 3 of the 4 products fall within the top 100 among commercial claims. 3 of the 4 of them are in the top gross spending. You put them together, they're in the top 5 of gross spending and out of pocket. 3 of the 4 are in the top 100s, number 6, 8, and 90. Put them together, they're in the top 5. They have a very high patient count. Ozempic has a very high patient count for commercial claims. It has the 2nd highest gross spending for commercial claims. It had a very large increase in 2-year spending in gross spending. And it has a certain amount of out-of-pocket spending. Trulicity, 3 of the 4, all 4 products are in the top 10. And at 7, 13, 27, and 74. So you put them together, they're in the top 5. 3 of the 4 products are in the top 100 of gross spending. 2 of the 4 products are in the top 100 of gross spending for Medicaid at 3 and 18. 3 of the 4 are in the top 100 in out-of-pocket spending. 2 of the 4 are among, that's for commercial claims, and 2 of the 4 in Medicaid. Trulicity had the highest patient count in Medicare claims, and the second highest count in Medicaid claims. They had very large gross spending. So in other words, they're all in the top 10 in a number of categories. So that's the reason why I think that they belong on our list.
Okay. Stephen, anything?
No, I agree with him.
Okay. Barry?
Nothing new to add to the summary provided of the data, just noting that, you know, there's something we've talked about before is that we're working with 2020 through 2022 data. And as part of the cost review process, something we've talked about is the importance of generating updated, I guess, rankings, if you will. Certainly an updated list of a top 100, but at each point in time, we will be looking at per regulation based on the most recent data. It'll be interesting to see how that evolves.
Okay, so is there anybody, Joe, anything else?
No, nothing from me.
All right, so we have a motion to amend and a second. Any other discussion? All those in favor, aye.
Aye.
Opposed? Great, thank you very much. All right, we'll move to B, amend the prior board action to approve Skyrizi and Dupixent for the cost review. Joe?
So I move to amend the motion previously adopted at the May meeting to conduct a cost review of Skyrizi at the same priority level as the diabetes drugs, and to conduct a cost review study of Dupixent as follows. I move to first strike the language at the same priority level as the diabetes drugs, and to conduct a cost review study of Dupixent, and instead insert and Dupixent when staff capacity and resources permit. This is to clarify that the organization and ordering of the cost reviews is consistent with board priorities and staff resources.
On the floor, is there a second?
Second,
Second by Jerry. Discussion.
I think we just have a limited number of resources, and I think it makes complete sense to prioritize.
And I think that's actually where we were at the board meeting. I think this just clarifies it.
Agreed.
Okay,
Just articulate what the motion is.
Joe can restate the motion.
In its entirety, what it sounds like with the amendment.
So move to strike or?
Amend.
No, when you struck, I wanted to make sure that it was clear that the first part of the motion remained, which concerned the cost review of Skyrizi. And just so that you could repeat, you know, what the motion is in its entirety, so that everyone is clear what's on the floor.
So read it again or?
Yeah, and I think just pause and then clarify the last part is probably what we're talking about. Is that what you're saying?
The chair could, when asking for discussion on the motion, summarize the motion.
Unless anyone has any questions about what the motion was, we didn't have any joint discussion, so I would say that the motion was fine the way it was read, and we can just call the question. Stephen, you good with
Yeah,
that?
I agree. I understand what he was trying to say.
Yeah.
That we're making those as a secondary things to look at.
Correct.
Yeah.
Everybody in agreement there?
Yeah, given that we have to make priorities, you have to make choices.
Okay. All those in favor, aye?
All right.
Aye.
Opposed? Okay, thank you. C, amend prior board action to approve therapeutic alternatives and specified list of insulins. Joe?
I move to amend the previously adopted at the May meeting. I move to amend the motion previously adopted at the May meeting that the proposed list of therapeutic alternatives for Ozempic, Trulicity, Farxiga, and Jardiance to also include metformin and insulins. I now move to amend the proposed list of therapeutic alternatives for each drug, Ozempic, Trulicity, Farxiga, and Jardiance, to include the list of specific insulins for each drug that has been provided to the board by staff, and to amend the motion to add, this is in quotes, approve the proposed list of therapeutic alternatives for Ozempic, Trulicity, Farxiga, and Jardiance as amended.
Motion on the floor. Is there a second?
Second.
Mr. Chair,
Yes.
point of order. In the prior meeting minutes, Dr. Okinawa, I apologize again. You've told me how to pronounce your last name and I'm just bad at retaining anything, is recused from consideration of therapeutic alternatives for Trulicity, Ozempic, Jardiance, Farxiga, Skyrizi, and Dupixent, and let the record reflect that is still the situation, correct?
Yes.
Thank you.
So noted. Okay. For discussion? There was a second by
Yep.
Dr. Anderson. Stephen, anything?
No, I understand the reason for having to include the specific drugs that we generally talked about last time, but we need to put in the specifics.
Okay. Joe?
Oh, yeah, I did. I was looking through my packet. Is there a list of the specific insulins provided in the packet? I just didn't get a chance to. Can someone point me to it?
I think it's in your red or orange tab. Is that right?
At least I see a whole list of them on the second page, like on
Yeah.
Farxiga.
I just found it.
You got 'em?
So we're not reading the whole list into the record, but the list is in the record, or?
Materials that have been made available to the board that you have referenced in your motion.
Yeah.
So that motion would incorporate the additional insulins into the proposed list of therapeutic alternatives and adopt that proposed list as amended.
Good.
Okay, any other questions? All those in favor, aye?
Aye.
Aye.
Opposed? And one abstention, correct?
Let me just say one thing about it.
Yep.
So I think that, the list is really a great list. What I think we need to do is make sure that everyone has a chance on the stakeholder council and other places to take a look at this list to see if there's anything that they would like to add or delete from the list. Because this is a very important list and there is a lot of judgment involved in whether or not a particular drug is a therapeutic alternative or not. So I think this list looks great, but I think we might want to get some external review of the list just to make sure that they are. And then moving forward, I think what we want to take a look at is which of these drugs are truly substitutes for the other, for these 6 drugs. That's, you could say it in a number of different ways, but, some of these drugs are used for one indication, but not for another indication. Some of them are used in very unique circumstances. We just gotta, as we start working through this list, a second list is to come up with what are the ones that are really alternatives to the drugs. These are all therapeutic alternatives, but some of them are closer alternatives than others. I don't know how to say it better than that.
Yeah, and I think Christine, this will be presented on the web in the stakeholder council as well, right?
Yes, Van, these lists are already posted on the
That's what I
website as
thought.
well.
Yeah.
Yes.
I have no criticism of this list at all. I just think we need to just make sure that it is, other people have taken a look at it, maybe MedCai, maybe somebody else takes another look at it. But then moving forward to reduce this list to a smaller number of drugs, which are really clinically substitutes for these drugs. Because if you're gonna if you ever decide to do something like reference pricing or anything like that, some of these drugs are, and some of these are drugs you would not use for something like reference pricing.
Okay. Are there any other comments before we leave this housekeeping that we had to clean up from last meeting? If not, I'll turn it over to Andy for review, or whoever I'm turning it over to. Krishna, Andy.
Right. Thank you, Mr. Chair and members of the board. Great. So the next thing we wanted to do, so first, thank you very much for the clarifying amendments that you're able to make. That helps the team move forward and basically gives us the path forward to move forward with the cost review process. So we just wanted to give the board a quick update on where we are and what the next steps will be for the cost review study process. I think we can address it in the presentation, but I did also just want to address Dr. Anderson's point of the purpose of the therapeutic alternatives. So as you mentioned, it's a very broad list. And the reason it's such a broad list is because the function of this list, as our regs are written, is to allow the board to collect information on those drugs in the RFI, and then also to consider any literature, so comparative effectiveness literature. So for the purposes as our regs are written, it's beneficial to have a much broader list. And then part of the process, part of the purpose of the cost review study process is to narrow down the list, as you had mentioned. So their inclusion on the therapeutic alternatives list is not any kind of indication that they're substitutable or interchangeable or anything like that. It is merely to allow you to consider those drugs as part of the cost review process. And then as we dive into the cost review study process, you'll be able to do much more kind of specific analyses, kind of more comparable to what you had mentioned. So I just did want to put a note on that. So this slide should look familiar. Here's our general cost review study process. So as you remember, we've gone through the initial meeting where you identified drugs that you wanted to consider for referring to the stakeholder council. Then you referred 8 drugs to the stakeholder council. We had a public comment period. And then in your May 20th meeting, you selected 6 drugs to refer to the stakeholder council process. So we wanted to walk you through what the process is moving forward. So once the drug is in cost review, there's a 60-day written comment period per our regulations, and that automatically triggered when the drugs were posted on the website. That public comment period is, again, just to allow folks to provide additional information that may not have been provided up to this point. And that comment period closes today. Though we are also looking for additional opportunities for more refined public input. And you'll see that you can consider public input as part of this process. The next step is the data collection process. So again, the board may request, post a request for information. There's 4 entities that can respond to the request for information. That's the manufacturers, carriers, pharmacy benefit managers, and wholesalers, distributors. We, now that we have a finalized list of therapeutic alternatives, we plan to post the request for information in the very near future. We'll be communicating with folks on exactly what that timing and process would look like. We were able to bring the template forms to the stakeholder council for input. And then also we were able to open it up for public input for about 2 weeks as well. We had made a listening session available for folks to provide, or input session. We didn't get any, we did get a number of helpful inputs, but nothing that dramatically changed the format of the forms themselves. It was more process issues and emphasis on how to manage the confidential and proprietary information we may be receiving as part of this process. The other thing I would flag is that these templates that we're going to be posting, the forms, are a voluntary tool that the board is making available to help make this process easier for manufacturers and PBMs, wholesalers and payers, folks that will be replying to the RFI. We will be working with them to accept it in whatever format is easiest for them. So our goal at this point is to try to make this process as low of a burden for the entities participating, and be as helpful as possible as part of this process. So we created these templates. We hope they're helpful. If we find out they're not, in future iterations, we can continue to learn from that process. So once that RFI is posted, go ahead.
I don't know about timing on this.
Yeah.
So this one will get posted, let's say today, well, but let's say today, we then have they have 60 days or 30 days and potentially 60 days. So would we be ready for the next meeting?
We'll build out the timeline once the RFI is posted, but technically your next meeting is in 60 days. So I think what we were targeting is to have all the information by around your September meeting, but then be presenting the information to you in your November meeting. So the information will still be coming in through the RFI process for your September meeting. And to your point on the timeline, so we hope to post the RFIs shortly. We will also do kind of a technical feedback session. So for folks that intend to submit the RFI, we want to have an open session where folks can ask questions and we can give technical guidance on what they're supposed to be submitting and how. Right now, we plan for it to be a public meeting, so it'll be available to everyone. And we were planning on including all stakeholders, not splitting up by different stakeholder groups, even though their forms may look a little bit different. We're getting different feedback that folks may want to only speak with manufacturers and things like that. So for right now, I would just say that we plan to have it as an open meeting for all entities that want to be replying to the RFI. And then to Dr. Anderson's point, it's a 30-day deadline for the first RFI, but there's the opportunity to request an additional 30 days. And that will play into timelines in terms of when information gets used for analysis in the dossier. Then the next step is for the team to analyze the data. So a lot of the information that we're collecting is publicly available or already available to us through the different data sources that we've been using. And then also what's coming in through the request for information. And this process, as you've seen in our regulations, we have a series of different analyses that we're trying to answer in the dossier, right? Each section has different factors that the board wants to look at to understand if a drug is causing affordability challenges. So we're in the process of drafting the responses to those different sections now. And again, we plan to put that together in a single document that we're calling the dossier, which is it provides the information to the board. It doesn't have findings within it, right? It's supposed to be a objective, like not making a recommendation or anything like that. It's analyzing the data and presenting it to the board. Ultimately, that information will be provided to the board, and the board can then make a preliminary determination of whether or not the drug causes affordability challenges. We want that to be, it's a preliminary determination because then we'll have the opportunity to refine the report over time before you make your final determination in the cost review study report. So there will be a final cost review study report where you make the determination of if the drug causes affordability challenges or not. Both of those would happen in open meetings where you make that preliminary determination, and then in a subsequent meeting, not necessarily the immediate subsequent meeting, but at a subsequent open meeting, you would make the final cost review study report. I think that we are targeting in the November meeting, by the end of this year, I would say by the end of this calendar year, we would like to have before the board the information in the dossier. So the board can then do what they would like with that information. But this calendar year, we hope to have the information before the board so you can make a preliminary determination.
I think, Andy, that the board would really like to see a more concrete timeline to be completely done between now and whether it's the end of October, November, whatever. But I think you owe it to the board in the next couple of weeks to try to get this under a more manageable or whatever timeline that you can get to the board, so the board can take a look at it so we know exactly where we are.
We can do that. We can build the timeline through those first 4 steps. We can build the timeline of what staff will produce to the board for you to make a preliminary determination, and we can get that to you. Again, we're targeting to have that done by the end of this calendar year. And then what the board decides to do with that preliminary determination is ultimately up to the board.
Right, Bear.
So I'm seeking clarification here too, because we have 2 more meetings left in this calendar year. So if the information is coming to us before the end of the calendar year, what does that mean for November's meeting as far as our ability to make a determination based on information provided to us?
Our hope is that the staff can provide the information to you in time for you to meet this second to last step, the preliminary determination of affordability. We want you to be able to make that we want you to have the information in time for the November meeting. If you were to use that meeting to do this work, you're welcome to.
Okay,
That's the timeline that the staff is working on to produce the dossier that you would base that decision on.
thank you.
I guess just to follow up, if there's any way that we could possibly do it in October, then we might be interested in having a special meeting.
Okay.
So I think you need to, again, spend some time in the next week with staff to see just how tight you can get this into, and if we need to have a special meeting, I think everybody is in agreement of that.
Great. Yeah, thank you for that information. We can do that. Yeah,
Yes, I'd agree.
great. Thank you, Dr. Rocco. So we can put that timeline together for the board. The rate limiting step will be the RFIs and how long it takes the staff to do the analysis on whatever information comes in there. But we'll plan out what our analysis would look like.
Yeah, well, again, I think we want to shoot for October, November, and the end of the runway is December, and we would have a special meeting the first part of December.
Mhm.
So I think, I've heard from several members, and I think everyone wants to try to get this across the finish line.
Understood. Thank you.
This is about the slide that you have up here, just looking at the 4th column where it says high out-of-pocket costs for patients, and then looking at our data collection, which is the 2nd column, that there is an opportunity in our data collection for us to hear from patients in the data collection phase. Am I reading that correctly? So any out-of-pocket information we're receiving would only be what we get from a payer?
We are working at around what our regulations allow for public input. So the board is allowed to consider public input, which is broader than public comments. And we're looking at every opportunity we can to get public input. I would say it's generally staff intention to be able to hear from patients as part of this process.
In the data collection phase?
In the data collection phase.
Thank you.
Not the RFI. So that data collection, that is specifically about the request for information. This would be separate from the quote unquote request for information process that we have. It would be kind of a public input process that we would have. Yeah.
Okay. That would be something I'd like to maybe hear more about as we go, is how that process for soliciting patient input would be handled.
Great, thank you.
Thank you.
All right. So the rest of the slides just kind of summarize everything we've just gone through. So I can actually go through this pretty quickly. We just reiterate, kind of reflecting on the selection process that you went through. We did have the written public comment process on the referred drugs. We did post the therapeutic alternatives, and that record was finalized today. We also had written public comment on both, again, the drugs that were selected and or referred, and then also on the therapeutic alternatives. You had an intervening stakeholder council meeting where they were able to provide input on the drugs that you referred to them. And then ultimately in your May 20th meeting, you selected the drugs for cost review. And again, now we're in the process of the collection and analysis. We again have a 60-day comment period, kind of again, it's just a placeholder to allow folks to provide information if they're interested. That is due today. We're also, as I mentioned, going through the request for information process in the very near future. And all that again is going to feed into the dossier of data and analyses produced by staff, and we're going to make that available to the board for your ultimate determination.
I'm aware that people always wait till the last minute to send in comments, but have we gotten any comments so far?
We've gotten very few comments. And I think it's been posted on our website, but I would say it was probably, yeah, we've received very few comments.
And have we received those comments? The
No,
board?
we'll send them to the board and summarize when they're received. But to your point, they have been coming in at the deadline. So I think they might have come in on Friday, so they're not on the website yet. But we'll post everything as soon as it's available at the end of the day today.
Okay.
All right, and I'll just go through these slides very quickly. These are going to look familiar, but these are basically just a summary of the drugs that you've selected in alphabetical order. So you selected Dupixent, and these are the NDCs that are associated with the BLA. You also selected Farxiga, and here are the NDCs that are associated with the NDA. Jardiance, which has the affiliated NDCs on the NDA, Ozempic, which has the affiliated NDCs on the NDA, Trulicity, which has the affiliated NDCs on the NDA, and then Skyrizi, which has the affiliated NDCs on this NDA. So again, just the way that our regs and I think our statute are written is that we roll it up to the NDA and BLA level. So that's kind of one of the limiting factors and one of the reasons that we included the NDCs. So all of these NDCs will be what our analysis is based on, and these are the NDCs that are under the cost review study process.
Sorry. So how do we roll them up? I mean, so for example, I totally get gross spending. That's the easy thing to add. But if we're talking about the average cost, I assume it's a weighted average of those for the, like the Skyrizi 10 or so NDCs on here. We do a weighted average of that.
Those, I think, are technical issues that we're working through. And the way that we would handle it is all the analysis now is happening at the NDC level.
Correct.
And it does help that it's a finite universe. The reason this roll-up exercise is so difficult for all 15,000 NDCs in the world is just you can't go step by step. But since now we have a finite universe, there may be a logic to where we may want to roll up. And for the folks on the line, this is kind of a technical issue. But I think we'll present options to the board on how you would like to see that information in the dossier. And again, this is primarily a technical issue. And then we would publish at whatever rolled up level that the board kind of deems appropriate. And we would explain that in the dossier. We would say, these NDCs kind of feed into this, like it would be explained in the dossier as in terms of how that methodology would work. So I think at a high level, it is pretty intuitive with the drugs that are produced on how you would want to roll those up. And I think we can certainly do that. It can be a weighted average, I think is probably a good way to do that. But I think that's something that we'll kind of flesh out as we pull the dossier together for you.
Okay.
And should not affect the findings of the results. I would reiterate that it's a technical issue that we would work through and how this analysis would work.
I mean, but you do have a number of issues of weighting by whom, is it by everybody and part of the APCD, or is it for Medicaid? Is it, because those are going to be very different weightings.
Right. Yeah, I think the way that we would handle it, how we handled in our dashboard is probably presenting all of the above. So you would have the option to see it broken out by payers and see the differences there. And then if we did do some sort of roll up, we would explain to you the justification for the roll up that we decided. I think we still probably keep, to your point, commercial and Medicare and Medicaid separated just because they, work in different ways and probably have different values. But I think what I heard you getting at is like, maybe there's one NDC that has almost no volume, but is twice the price. Like, how is that going to affect the overall like cost of the drug? And I think we would provide that information to you and kind of let you, I mean, part of it is also exploratory findings, right? But we need to kind of see what everything looks like in the claims data. And we would point out issues that come up like this, like, oh, here's this, what seems to be an unused NDC that is wildly out of proportion from the rest of the NDCs. Like, that's information that you can consider. Yeah.
No, I get that.
Yeah.
This is not something that we have to vote on the board, is it?
No, I think it's going to be a framing in the dossier, and part of it, of having this preliminary determination is, again, I would guess that all of this would be presented to the board. Like, as much as possible, we will give it to you in multiple formats. And then maybe if you decide that you only want one of the formats to be used in the final report, that could be something that the board could provide feedback or vote on. But I think at this point, the point of the dossier is to just give you as much information as possible, also as clearly as possible. We want to make sure we don't overwhelm you with gibberish as well. So,
Thank you.
yeah. All right. So just briefly going through our comment period. So again, we had a comment period that folks are always allowed to provide additional information to us. Again, ending today, close of business. So folks are welcome to provide that information to us. Please submit comments to comments@pdiap.maryland.gov. And we will be posting those comments. So they are public comments that will be posted on the website and available to the board. We also do have a process if folks want to submit proprietary and confidential information. So if you do intend to do so, you can review our regulations or just reach out to us directly before you send the information, and we can kind of walk you through that process. And then additional information on the cost review study process is on our website. We're continuing to build that website out and continue to try to make it more user-friendly and provide all the information that we can to folks. So please continue to watch our website. And for major deadlines and things like that, we try to use our Gov delivery notice. So folks that receive this notification about our meeting, it's that same listserv that we use for everything. I would just say, make sure that it's not going to your spam folder, because that is where kind of like notifying folks that, comment periods are open and we want to hold these sessions and things like that. That's all going to be posted and announced through that process. All right. And then just again, talk through the collection process. So we do have what we think is pretty close to a final form. So we're hoping to engage in the RFI process shortly. We look forward to working with our partners in the manufacturer space, the health insurance space, the PBM space, and the wholesaler distributor space. When the RFI is posted on the website, that is the official notification, is the posting on the website, but we will do direct outreach to the folks that we think will want to submit information on this. Sorry, any questions from the board on that? And then just in terms of the timeline, I think we're trying to post as soon as possible. We will continue to update the website, and I think we probably want to have our technical session before the RFI starts so that doesn't eat into that timeline. So we should be able to provide an updated timeline to the public in the very near future. And then once the RFI has started, it's a 30-day timeline, but then there's also the opportunity to request a 30-day extension. And with that, that's where we are in the cost review process, and looking forward to move forward with it.
Sorry. Yeah, sorry. So in terms of timing, so you're going to have a meeting of like the manufacturers before you do the RFI?
Once all the forms and directions are posted, we expect that folks will have questions, and a lot of people
But that would
probably
start, once it's posted, starts the 30-day period.
We will note on the website when the RFI has been quote unquote posted. I guess we can work through the logistics on if this meeting is going to happen before or after. But we do want to make sure that we're available for questions, publicly available questions, as folks start to go through this process.
And do we have a sense of the RFIs coming out next week? Do we have a tentative date?
We are tentatively shooting for posting the updated therapeutic alternatives today, and then we have everything ready to roll out as soon as this week. Yeah. So I think the timeline that we were working on is we want to have all of the information coming in around when your second meeting is, within a couple days. So.
Yeah, and it would be nice if it was before the second meeting.
Understood. Yep.
Joe?
And that manufacturers meeting, is the idea that would be the 6 drugs that are having cost review done on them, or does it include the therapeutic alternative manufacturers also?
It's going to be all entities that can submit for the RFI, so including wholesalers, PBMs. We're also probably don't have a mechanism to restrict who's coming, right? So I'd imagine that there's going to be policy folks that kind of listen in on it as well. We want it to be kind of an open session just so we can answer everyone's questions at the same time and everyone has the same information. Once folks engage in the RFI process, we will be able to have kind of more direct communications with folks that are submitting the RFI. The purpose of this meeting is basically just to have it as a Q&A and technical assistance as folks are trying to navigate this process since it is a new process.
So let me just, so Jerry's question a few minutes ago in regards to when you talked about having this to me like another step or an extra meeting. I think the question is or was, is the RFI process going to start when you had that meeting, or are you going to start it 2 or 3 weeks after that meeting?
No, it would start right around when that meeting happens. What we want to make sure is that the folks that are attending that meeting have had enough information to ask relevant questions. So if we have to post the materials and then that triggers the RFI starting, we just want to make sure that they have enough time with the materials to ask us the technical questions of how to submit to the RFI. So we can touch base on our team, but we're expecting them to be in close sequence, whether or not, like, what is the RFI is officially posted, the timeline starting. We just need to double check on that on our side.
So, I mean, it's up to you, but I would encourage you to post it now and have a meeting later, because it could take 2 weeks to get a meeting set up.
Okay. Great, thank you.
Yeah, I think that's that's what I got from his concern.
Yep.
You know, like could be 30 days after that.
Right. Yeah. Our intention is for the RFI to begin shortly.
Okay.
Now that we have therapeutic alternatives.
And then what's the process if somebody wants to submit confidential data? What's the process for the 5 board members to get access to that confidential information?
So we have policies
I got
related.
that.
Yeah. So we will educate the board members on their responsibilities in terms of confidential proprietary information. We have kind of the tools and processes on our side to accept and manage confidential proprietary information on the staff side. And then there's going to be a process that the board members need to follow to access that information. So that's I'm not sure.
So essentially I go on some secure website to look at this data.
At a high level, but there's a lot to that. Yes.
I
Yeah. But at a high level, yeah.
But essentially, it exists someplace. I don't have to go there. I can.
It's going to be available virtually to the board through secure
Okay.
mechanisms.
Yes.
We're looking at getting you specific laptops or tools for that. Like we will have those answers for you when that time comes. But there's going to be a process for the board to access the information that is being securely stored with the board.
Just don't use CloudLink for the secure storage.
Fair enough.
Can I clarify, just so I understand it before I ask my question? So the clock starts ticking for the 30 days when the RFI is posted or when the meeting happens? When the RFI is posted?
We will clarify that on the
I
website.
see,
I'm not
okay.
sure how much we want to deliberate that on right now, but
Okay,
basically
so that's still to be decided.
what we want to do is post our materials.
Under the regulations, it's when they're posted.
That's
Right.
what I thought, okay.
So my concern is, can we post the materials so people can review it without triggering the request for information time
I
period?
see,
Yeah,
okay, so that's the part to be clarified.
yes, but we can get a response to you and the public shortly.
Okay,
Well, can we answer that now?
In accordance with your regulations, when it is posted commences the beginning of the 30-day time period. Period.
So we will
But
build,
Andy, I just don't understand why we can't post it, tomorrow or whenever you're ready. Because if I'm a manufacturer, I want to see what the request is before I'm going to have a meeting. I mean, I don't want to have a meeting if I don't know what you're requesting.
yes, I think we're saying.
That's what they're doing.
Yeah, no, what I didn't have an answer on is we post all the materials tomorrow.
Yes.
Does that start the timeline, or can we say after this, we're gonna have a meeting on Friday and the RFI officially starts on Monday.
No,
It sounds like no.
I think your assistant AG's
That's
shaking
right.
her head. I
That's
think
right.
she's answering your question.
Yes.
And I think it's good for us to understand.
Yes, I apologize.
Because everybody's concerned about it.
Yes, that's right.
So again, if you're gonna post, then I would give the manufacturers a week. Have your meeting toward the end of the week, and then you got 3 weeks after that, right? That's 30 days.
Sounds good. Great, thank
And
you.
they can,
Yeah,
they
thank you for
can
sharing.
also always request an additional 30 days if they really need it.
That's correct.
That's right.
That's correct.
Yes, it's so just to maximize the time available, I agree. So then my question is, with regards to collecting data on the patient's perspective on costs, there's a lot about this process we're learning and we'll learn as we implement it, certainly for the entities already mentioned in the data collection process. What I guess would be concerned about is that we allow enough time for the socialization, the education, the outreach that will be needed for a meaningful data collection process for patients.
Yes.
So that seems to me to be a priority if we're to allow for October or November, even at the latest, for us to consider that kind of information too.
We agree. Yeah, thank you.
Progress. Next.
Great. So that's everything on the cost. So that's where we are in the process. We have an exciting couple meetings in both September and then November. So we appreciate the board's feedback on that.
Does anybody have any, let's pause here.
Yep.
Because I think this is important. Does anybody on the board have any comments to staff or Michelle in regards to what we've just gone over? Timeline, RFI, anything? Now it's time to ask.
The only thing I would add maybe that is with staff bandwidth in mind, that we pay attention to any available sources of survey information where patients have already been asked about cost burden, generally, where they're not kind of, it's not about drug X or drug Y, but what are the drugs representing a cost burden, and see what we can learn from that. While trying to do the more tailored analysis, because I do appreciate that the 60 days will go by in a flash, or even the 30 days, even for the more kind of quote unquote straightforward requests. This one is going to be a little bit more nuanced. And
That's
so
right.
paying attention to what data sets are already out there will be helpful.
Joe?
And maybe just to add to that, I mean, you mentioned eventually some literature review for comparative effectiveness and, you know, with therapeutic alternatives. And should there be some literature review for these types of patient-reported cost instruments that probably exist for some of these drugs?
Great, thank you.
So I'm just trying to understand, you know, with this 60 days or whatever, what we will have access to in the next meeting. You know, and what we will have to wait for in the cost review side, not the UPL side, but in the cost review side, what won't be available at the next meeting.
So we will talk as a team to figure out what, if we can share iterative versions of the dossier, but a lot of our analytical work based on claims data and potentially literature reviews, you know, we're tracking to try to have drafts of all of that done by September. The issue would be anything that's supplemented through public input and then also the request for information. That's probably the things that would probably still be outstanding, and obviously they're very important.
Well, they're clearly important. So,
Yeah.
so when can we say we have completed a cost review?
Our hope is that we have a draft dossier available to the board by the end of this calendar year, that you can then make the preliminary determination of if it's causing affordability challenges. Right now, the only meeting that you currently have on the books is for November, so it's a timeline that we'll target. So our hope is to have a draft of a dossier that gives you the information that you need to make that determination by then.
But in the previous meeting, so in the September meeting, will we have most of the information to have a complete cost review available? And we still waiting for the public comments and the manufacturer's comments potentially, or maybe we don't have them, but what won't we have in the September meeting?
So we will discuss as a team on what would be presented from the November meeting, but again,
September.
excuse me, for this September meeting. So if it's possible and it makes sense to provide draft results, there may be reasons that the board may not want us to provide draft results, but we hope to have a working draft of the dossier for everything that doesn't require public input and the request for information kind of ready around that September time period. So everything that we already have access to, plus literature reviews, et cetera, that should, we're targeting having those done by September. Now, does the board want us to present an incomplete dossier or results in the September meeting? I think we'll work with the board if that's would be helpful. But I don't think we.
Yeah, I mean, I'm happy to take a look at it on the 1st of September and see where we are, decide whether or not how much public information, but by September 1 or something like that, I would definitely like to see what is available and what is still missing.
Great.
Okay. Stephen, anything from your standpoint?
No, I think I understand. We just want to get things done as quickly as possible, so we can make real decisions and determinations and hopefully get it all done before the end of the calendar year.
Okay,
Great, thank you.
thank you.
We can move on to the next agenda item.
Yep.
Which is the finalization of the fee assessment regulation. So we just have a presentation for you. So I can brief, did you want to go through it?
Oh, the 50,000 foot version, next
Yep.
slide. These were regulations that you approved back at your March meeting. These are technical corrections to the Prescription Drug Affordability Fund. Essentially, it's allowing staff to review the assessed entities when they're granted exemptions, et cetera, and to update the list on a rolling basis, but at least once a year. Next slide. It clarifies the language in the proposed regulation, which you have in front of you, clarifies a variety of things, but that entities can be added. It got rid of the requirement that they had to be not subject to assessment for 3 consecutive years. And now they can be removed if they have been determined to be exempt. And again, this is a housekeeping mechanism. Next slide. And this is just going through your proposed regulations were submitted to the Administrative, Executive, and Legislative Review Committee. They were published in the Maryland Register. The comment period closed July 1st. There were no comments. So moving on, this is the draft language, which was basically just explained a minute ago. There have been no changes from the text previously approved. Next slide. Therefore, it is now before the board to determine whether or not to submit these regulations as final regulations for submission to the Division of State Documents and publication in the Maryland Register.
Great, thanks, Michelle. Is there a motion for approval, final?
So moved.
Second.
Second, Stephen, motion, Jerry, second. Any questions for Michelle or Andy on the regs final? All those in favor, aye?
Aye.
Opposed? Thank you, approved.
Yeah, just a question. How many entities are actually providing dollars to the board right now?
So we are, part of the reason we needed to take care of this list, the list was originally created by, from the Insurance Administration. They provided the carriers and the PBMs, and then the Board of Pharmacy provided the wholesalers. Right now, it's about probably 1,500 entities that are on the list that receive the invoices. And right now, I think we pull in maybe about 1.025. So, 1,025 entities.
So it was around 1,500 at the high. It's going to be somewhere between 1,000 and 1,200.
Yeah.
Mm-hmm. Okay.
Yeah, thank you.
And that covers our costs.
At this point, our operating budget is less than what our revenue is. Yes.
Okay.
And we'll provide.
Can I ask, are there any glaring entities that are on the non-pay list? Some big manufacturer or insurance company that didn't pony up?
I think the biggest challenge is there's a series of entities that happen to be registered as wholesalers and also as carriers that don't understand why they're receiving this invoice and may like not do anything with it, basically. So if they don't know what this entity is and why they are being assessed, sometimes they are the ones that are not responding. So it's I would say it's a lot of smaller wholesaler shops, and then also like insurers that aren't a one-for-one health insurance, so they technically fall into the definition of carrier. Yeah.
And that was.
Okay, small insurers and small carriers, I'm not too worried about. I'm concerned about the Optums, the United Healthcares, the Care Firsts, et cetera, that may or may not be paying their fair share.
Yeah, no, I would say all of our partners have been very responsive and helpful working through a new process that we've been setting up. So.
Okay.
Yep.
Yeah, and as far as the budget goes, this was a 5-year budget that we did based off of the revenue. We figured we'd be somewhere between $1 million and $1.2 million. We never thought we'd be at $1.5 million. It got a little bit inflated with some of the, I think, MIA lists, and also Board of Pharmacy to a degree. Sometimes, when they've been around for 15, 20, 30, 40 years, they don't clean up their own list sometimes, and that's normal. And so we had that issue. So Andy's worked closely with the Ligon Health Underwriters Group to get that cleaned up. But as far as the budget, we are now over $1 million for the last 2 years, and we've gotten some money that was in 19 and 20 that is back in our reserve pool that from prior years. So I think we're in pretty good shape at this point.
And we'll provide a full budget report in the upcoming.
All right, moving on to number 6, UPL action plan report.
All right. So this has been a topic that we've been talking about for months now, but I'm excited to provide a quick update on where we are with the upper payment limit action plan. So for everyone's reference, the board has the authority to set upper payment limits for state and local government. And to use this authority, the board must approve an upper payment limit action plan that then goes to the General Assembly Legislative Policy Committee. If the Legislative Policy Committee does not approve it, then it can go before, I think, the governor and the AG.
Attorney General.
Yeah. So that's how this process will work. So ultimately, the board is trying to put together a document that answers the following questions, or basically describes how an upper payment limit would be set within our current authority or be implemented. The plan of action must include the criteria that the board should use to set the upper payment limit, including the cost of administering the prescription drug product, the cost of delivering the prescription drug product to consumers, and other relevant administrative costs related to the prescription drug product. So that's per our statute. So at a high level, we just wanted to provide a quick update on the framework, and then I'll talk through timelines and next steps. But our goal, we've presented this to the board, I think probably as recently as the end of last year. Again, just kind of talking through high level ideas and then getting feedback from the board. So I think we're close to the point where we think we have the framework that we will be using and we want to publish in the upper payment limit action plan. We're going to go over some of those high level points today, and then hopefully we'll be publishing the upper payment limit action plan shortly. So we'll go over the policy review and selection of policy process, proposed method for setting the upper payment limit amount, some discussion around eligible governmental entities, and then the staff proposed implementation of upper payment limits. So as we discussed in the cost review process, we're hoping that the final step in the cost review study process is a preliminary determination of affordability challenges. So we want the board to make their preliminary determination that will then kind of trigger the next step, which is, okay, the board says that these drugs cause this affordability challenge. What are we going to do about that? And that's what we're calling our policy review process. And if the board, again, just has a preliminary determination the drug may cause affordability challenges, the board may engage in a policy review process to consider options to address the affordability challenge, including an upper payment limit. So at that point, there's going to be an information gathering phase. So the board can convene a series of hearings or testimony or other tools to understand upper payment limits, and then also other policies that are available to the board to address the affordability challenge. The board can also request stakeholder council input, and the board can also have staff conduct research or policy options for different issues. And then there's the preliminary list of policy recommendations. So staff can present the draft cost review study report to the board. The board, the staff can then present the options to the board. And then also, if the board says that as part of that process, we should be looking at upper payment limits, we can provide the initial analysis of the upper payment limits as well.
Just want to ask about timing here. So if you go back to the previous slide, when can we start information gathering? When can we start preliminary policy recommendations?
This would all be contingent on the Legislative Policy Committee approving the upper payment limit action plan. So I think we want to be careful not to.
So
essentially
the answer is after they've approved it.
Yeah.
Do we have to do anything else besides them approving it?
We may want to pass emergency regulations or general regulations to amend our cost review process to be able to account for this new process for setting upper payment limits.
So we can't do anything in this until the legislature approves this. If that's the case, we are going to have to wait until the September meeting to start that process, or can we have an interim meeting before that?
Well,
because I mean, we've been talking about upper payment limits for a year, 6 months. You know, I'm ready to move forward. And so I just wonder why we can't move forward.
Understood. I think our hope would be to, in the September meeting, or potentially the November meeting, but we're targeting the September meeting, have an upper payment limit action plan that the board can approve and then send to the Legislative Policy Committee. Once it's with the Legislative Policy Committee, they have 45 days to approve it. And then once it's approved by them, then it's live, and then you may need to take action to adjust your current processes to account for this new authority that you have.
Right.
So that's the timeline that we're working on, and if you can build it out with the meetings that we have on the schedule.
I mean, I don't want to make more work, but you know, we've had interim meetings that like in August. If we could do it then, it would be better than doing it in September, given the timeline.
I think once we have if the legislative or the upper payment limit action plan is approved by the Legislative Policy Committee, we can work with the board to set any kind of ad hoc meetings that you would like.
But I'm saying to get the thing to the legislature in August instead of September.
So
that, I mean,
I see what you're asking. I'm sorry.
Yeah.
The process requires that the upper payment limit action plan is put together in conjunction with the stakeholder council.
Right.
So the reason we're shooting for this schedule, we're presenting this information to you now so that in the August meeting of the stakeholder council, they can provide their input. So we currently have a stakeholder council meeting on the books, and that's where we hope for the stakeholder council to provide their input and work in conjunction with the board to finalize the upper payment limit action plan. So theoretically, if staff can take all the input that comes through that process, I mean, we would work as quickly as we could and get a final version to you. That's kind of the rate limiting step, though, is making sure that we get the input from the stakeholder council.
Can we get a preliminary version before you send it to the stakeholder council? We may want to, you know, make some comments before it even goes to them.
Understood. Our intention would be to publish a draft that the public can see as well. I think the board can provide guidance on certain areas before that. You know, I think individual board members are welcome to provide feedback to the staff. But ultimately, I think we want to have a draft that's available for the stakeholder council and the public so that they can all see and provide comment on that. And then the stakeholder council would be one of the forums where both the stakeholder council themselves as experts, and then also they have their own public comment process. We would expect to see public comments there. And I think we would want the public to be able to provide written comment on a draft as well.
I think this is another scenario where if you could spend the time to put a timeline together all the way through the legislative approval process,
okay,
it would be helpful to us. You guys work with it every day. We don't. And I think we've got multiple things going on, and you got multiple regulations on different things. And so I think it would be extremely helpful, at least to me, to lay out the timeline all the way through best case scenario. And if we have to move forward or backwards, the board can make that determination. But I think it would be very helpful to see these things laid out on a piece of paper.
We can certainly do that, especially for the best case scenario. There's obviously the contingencies.
Yeah, I mean, because I look at this and I see information gathering. If we can't start it until the legislature's approved it, I mean, I'm sure we can do some background stuff, but if we can't officially start it until then, that's not starting it until November. And then you have to preliminary policy recommendations, that's not till January. And then we're talking March and, you know, time is just passing.
We understand.
And does the legislative policy in the hearing schedule have their schedule of standard meetings that they have?
We have not been in touch to get onto their schedule, so we can take a look at that and
I think you ought to.
Yeah.
Because even if you have to bump it back, but you need to get on wherever they, you know, they might only be meeting on a quarterly basis in the interim.
yeah, that's a good point. We will take that into consideration. We wanted to make sure, because we've had ambitious schedules on this before, we wanted to make sure that the report was in hand and had a timeline for approval by the board before we tried to get on their schedule. Yeah. But we can certainly do that. It needs to happen by the end of this year. So. Great. So again, just going through this new framework. So just as an update, we expect your preliminary determination on affordability challenges to open up a process that we're calling our policy review process. The board will get information on potential policies through a number of different mechanisms. And ultimately, throughout that process, the board can identify the different policies that you want to use to make a prescription drug more affordable. That can include upper payment limits. And then the final step is to have a final report that includes the final determination of affordability and the final policy recommendations from the board. And one of those can be an upper payment limit. The report itself kind of fleshes out exactly what those steps and processes are. There's a number of different steps where you're going to want different inputs. Certain things should be happening in meetings. Other things can kind of happen at the staff level, but we'll outline all of that and make sure that that's available in the upper payment limit action plan. We have a number of criteria that we want the board to be able to consider when you're setting the upper payment limit amount. I think these should generally be familiar. A lot of them align with what's already in your cost review study regulations. So you'll see that a lot of the information that you would consider as part of this process would ultimately already be available to you through the dossier and the cost review study process. So it's almost like the next step of like, okay, we have all this information. We decided the drug is not affordable. What do we do with this information? One of those things could be setting upper payment limits.
Can I ask a question?
Yeah.
What have we been doing for the last year other than doing all this?
It's a great question. Yeah, we've been working on a lot of, we've been working through our cost review study process, which has been very time consuming, just putting the regulations into place. There's a lot of time just in terms of getting access to the data that we needed. We had the data probably around the end of last year. Our regs were finalized at the end of last year, which allowed us to start, this is for the cost review study process, which then allowed us to kind of build out our sequence of meetings to work through the cost review study process. Right now, you're in the middle of that process now, which we're hoping to finish by the end of this year. But yeah, I think it's a lot of it has been just kind of working through the process of setting up a new, cost review study process.
Yeah, well, I thought that when we went through the whole dashboard of all the costs of all the hundreds of drugs that we looked at, and we finally settled on these last 6, isn't that listing our drugs that we need for upper payment limits and work on those 6? What else do we need to do? I'm not sure I understand.
Yeah, so we want to be careful to say that right now the board has the authority to do cost review studies. And that means that you are, so you get to look at specific drugs, you get the publicly available information, and then based on that, you can decide on, or the information that's available to you based on your regulations, and then you can decide that you want to do a deep dive and actually understand the issues of if the drug's causing affordability challenges. So that's what the board can do right now, is these cost review studies that lets you look under the hood and try to understand if a drug is unaffordable. And at the end of that process, or causes affordability challenges, the end of that process is the board says, yes or no, this drug has led or will lead to affordability challenges for the healthcare system or high out-of-pocket costs for patients. So that's what you currently have the authority to do. What we're doing now is your statute has a provision that gives you the authority to use a specific tool called upper payment limits, but there's a process for getting that authority. And part of that process is saying exactly what it means to set upper payment limits. So that's the exercise that we're going on. They are parallel processes, though they are obviously related. I think that's where a lot of the confusion comes in, is you can do a cost review study on any drug in Maryland, and you can look at if it's unaffordable for any patient in Maryland. But the upper payment limits is a tool in the toolbox. Like basically, you can look across the entire state, and then you have these tools that are available. One of those tools is setting upper payment limits for state and local government, which is obviously like a subset of all Marylanders. So part of what we're doing now is potentially tying these two processes together, right? Your cost review is kind of the precursor to recommending policies. One of the policies that the board has is upper payment limits. So we just need to talk about how those two things tie together and then put that authority into place and then update the process to account for that. We appreciate the board's feedback though on timing and
So I think at least we could consider, I know we have to have a stakeholder meeting for the upper payment limit, but assuming that they don't have major recommendations, can we, essentially do it a few days post the stakeholder meeting?
I think that question has been asked and answered 100 ways, Doctor. And the answer is it's going to depend on all of these other things lining up. And I think Dr. York has promised to come back to the board with a timeline, giving you the best scenario to be able to give you specific dates when these things would be able to be done.
I'll say this, I think what we should be prepared to do once we get the timeline is the board takes a look at it, sends Andy and I comments. And I have no issue after Christina deals with the stakeholder council in August, of possibly putting in a meeting the 1st of September, Labor Day-ish, right after, and then moving the September back into October. So we set an October meeting at middle or I try to stay away from meetings where Christina and Andy and them have 2 meetings in the same month to prepare for. So, but we could do a scenario possibly once we see the timelines of a meeting the 1st, 2nd week of September, 1st or 2nd week of October, and then the end of November. And then do away with the one late September, kind of move them around a little bit. So does that sound good to everybody?
Absolutely.
Okay. Andy and I will work on that, and we'll, with Christina and the stakeholder council, and we'll try to make sure that we can get everything working to maybe sync that up. So, and we'll make sure that the extra meeting in September will be virtual. So be a little easier on everybody. Okay?
yeah, thank you for the feedback. Just continuing to go through the framework that we expect to be in the upper payment limit action plan. We were just talking through the eligible government entities. So I'd mentioned it's limited to state and local government, which is state employee, state, county, and municipal employee health plans, the direct purchases from the state. So you can think things like the Department of Health or Corrections, and then also Medicaid. And we were planning on doing this work with a subset of these entities. Because there is a lot of kind of logistical and technical work that goes into actual application and implementation of something like an upper payment limit. So we wanted to work with a subset of entities that kind of have the capacity and resources and interest to make sure that these succeed. So we're calling that a pilot program, though I think we're open to the board on if and how we should be using that terminology. But it would be a subset of the entities that are technically regulated by our authority. So happy to answer any questions there. Otherwise, just wanted to communicate that. I think we can, as part of the action plan, try to include the folks that we intend to engage through this process. and go from there. Next slide. Yep, and then finally, so the next steps, we've kind of gone through this a few times, so I can go through it pretty quickly. But the board will publish a draft of the upper payment limit action plan. And again, it's going to be a draft that we intend for the stakeholder council to provide input on, and then hopefully the public as well. The stakeholder council will provide their input to make sure that the upper payment limit action plan is done in conjunction with the stakeholder council. And then ultimately in an open meeting, the board will approve the upper payment limit action plan and refer to the legislative policy committee for review and approval. That's all will be included in the timeline that we provide to the board members per your request this afternoon. So that's everything we have for the upper payment limit action plan. Happy to talk through any questions that you have.
It's just a question on the process with the action plan. The pilot is what we're approving, a list of key partners or an approach to identifying key partners?
We will try to list the partners that have indicated that they want to work with us on this project. So I would say that it would not preclude other entities from telling us that they want to work through this process with us. But there is a set of entities that we're preliminarily hoping to work with that I think we were hoping to include in the upper payment limit action plan.
Okay.
Is that like specific agencies or county governments or something like that?
Yeah, that's a good example. And part of the issue is especially when you get down to like the municipal level and things like that, there's just so many entities, like direct purchases from the state. There's multiple agencies that can do direct purchases. So we've been doing a lot of proactive outreach, but you know, as I'm sure we haven't reached out to everyone that could theoretically fall within our authority. So I would say that the list will be the folks that we hope to work with, but other folks will be allowed to pilot for their interest.
And to clarify, it would be elective from the perspective of the organizations wanting to enter in, or elective from us?
I would not call it elective. I would call it a collaborative process. We want to work with the entities that want to help us build out this process. It does take time and resources on their part as well. And so once we've implemented with certain agencies and entities, we will have a kind of a pathway forward that we can then apply to the rest of the entities that are regulated. So I think the goal would be kind of work through the processes to actually implement it, and then you can apply to other entities as you see fit afterwards.
For me, the word pilot's a problem.
Okay.
In that it essentially says, we're going to try this and maybe it won't work. So we're not going to, I mean, we're essentially, if we decide to go with upper payment limits, we're going to do it. And ultimately, all the state entities would participate. We're just, and right now, doing it for a select number of entities in the program. But I think it's got to be clear that ultimately everybody should participate.
We can address that in the action plan.
Would participate as opposed to should participate.
Mm-hmm.
The right terminology is, but you know, essentially they will play.
Correct.
Yeah, and how that process works, whether it's election or certainly not selection, but how individuals who aren't proactively contacted, how they are to self-identify. That would be something also to clarify.
Yes, we can certainly do that. Yeah, how they can reach out to us if they are interested. Yeah, because right now it's there is no central list of all these entities. We have to go and find them. Yeah. Great. Any other questions on the upper payment limit action plan? We look forward to building out that timeline for you.
All right. If Christine or somebody could write this down. Here's the way I see this might shake out. Stakeholder Council, August 26th, which is scheduled. We would cancel our September 23rd meeting, possibly a meeting on 9/9, which is after Labor Day and before Columbus Day. Again, cancel September 23, meeting October 7th. And then we would keep the meeting November 25th. Okay, so if y'all would check that out, that would be
great. We'll build our schedule on that.
And hopefully that gets you away from having multiple meetings, and all except for one, October. Okay.
Appreciate that.
Everybody good? Next.
All right. This may be a quick presentation.
Good.
So the general idea here, go ahead. Yeah, so the, yeah, I guess I said that. The general idea here is that the board publishes an annual report. As part of that annual report, you are supposed to summarize drug pricing trends. You also are supposed to summarize your cost review study results. And then also you can make recommendations. And up to this point, our annual report has always been very kind of just the facts, ma'am, describing the pharmaceutical market, very short to the point. We haven't had cost reviews and we haven't had to summarize. And then also we haven't had recommendations. But in previous meetings, we've talked about the idea that the board can use these reports to do deep dives into specific issues. We wanted to gauge the board's interest in if you want to include any policies in this year's report. The way this would work is you just would give us a general indication that, yes, we are interested in doing this, and here are some of the policies that sound interesting. We would then probably take this to the Stakeholder Council for any of their input. And then in the September meeting, we would want you to tell us which policies you want us to include in the report. And then in November, you would finalize the report. It may be something that we don't want to do this year. We can put it off another year. But we just wanted to provide this option to the board. And I would say that at a high, I should include this on the report. At a high level, we started with policy options that fit in two buckets. One, sorry, go ahead, Mr. Chair.
No?
Okay, we started with policies that have two general themes. One is aligned with federal regulations, so things that are already happening at the federal level. You can do similar state level policies and have similar outcomes. So it's like been tried and true to the federal level, and we can apply to the state level. The second element is trying to do more market-based interventions. I think step one in a lot of these cases is just try to make the prescription drug market a more competitive market where competition drives prices down. So we have a couple policies in here that also kind of align in that space. So those are the two general themes, which we thought the board could do without kind of a deep dive on specific issues. In future years, maybe in like early in the year, you can say, we want to do a deep dive on PBM issues or different kinds of parts of the pharmaceutical supply chain. And we can do deep dives and do that here. For this, we thought we just had a series of policies that are options for you that kind of fit, again, those two principles, align with federal policy and make the market more competitive.
So I have two questions. Since this is an option for the board to decide whether the board wants staff to do this year or delay it for next year, given that all of the work that you have on your plate now, before I ask the board how they feel, do you have someone who can do this? Is this someone that's part-time? Is that where I'm thinking you're going with this?
Yeah, it's a great question. We do have a member of our team that is not working on cost review study process at all. Her entire job is getting our reports that are due out the door. So this would fit into her portfolio of including different policy papers and things like that. So we do have a staff member probably with us for the next few months that would be able to get this work done, and it shouldn't impact our cost review study work at all.
All right. Does anybody on the board have any special heartburn one way or the other with this?
I just, a clarifying question, few months, like 3 months or through the end of the year?
She's a recent graduate and in the job market. So she's with us for the foreseeable future, but is looking for other opportunities that may come up. Yeah, so I would expect her through the fall probably.
I mean, some of these are very complicated issues.
Agreed.
And, somebody who's in part-time basis with not a lot of experience is going to have difficulty working through one of these, let alone almost 10 of them. So, I mean, I think, and it will take your time and it will take other people's time to do this. So I would prefer to postpone it until, next year, when hopefully we do have more time and work through most of the regulatory processes.
Great. That's
Joe?
Yeah, I mean, you said produce policy papers or review policy papers?
Produce policy papers. So the way that this would work is like we have kind of summary papers now, but then the board says we are interested in promoting biosimilar interchangeability at the state level. So then we would produce policy papers that basically flash out exactly what that would look like, any required legislation, pros, cons, that kind of thing.
Yeah, I think some of those, like that work is ongoing across the nation in a variety of different places. And I don't know that I see it as our best use of our resources to spend time doing that.
Right, I agree. We are just, we're struggling to get our upper payment limits out the door with 6 drugs. We don't need to start looking at, the whole biosimilar exchangeability, drug price combinations. That's just much too much for us to chew off right now.
Great.
Okay, so I don't think we need a motion on this. I think the board is, wants to help support the staff, whatever. I'm hoping that you can take her for the next couple months and
Yes,
have
right.
her help the rest of the staff do some other stuff.
Yeah, we have other required reports that she's working on.
Okay.
So, yeah.
All right.
Yeah.
The one thing I would say, just to Dr. Levy's point, is a number of states are doing work in this space and other states are passing laws. Like, this is potentially a mechanism for the board to say, this state has done this and it worked. We want to do it in Maryland. So I don't think there's any specific examples in this presentation, but just for future years, this is a good mechanism for the board to make those kinds of recommendations.
And I totally agree with you. In future years, this is a great thing. And some of them that are on your list, I think, do make a lot of sense. I just don't think we can have it ready for the legislature that's going to start in January and have worked through the details. So I think it's another year before we would go to the legislature with something like interchangeability.
Great, thank you.
Right.
That's a quick presentation.
Anything
All right.
else?
I don't think so. I think we just have administrative updates at the end.
Okay.
Um,
Thank you, Michelle. Thank you, Andy. All right, you want to start on yours?
Yeah, so we just have two minor administrative updates. We have closed the FY24 budget year is closed. So we're going through the closeout process, which is supposed to happen by the end of this month. So in your September meeting, we'll provide a report just summarizing our revenues and expenditures. I think we have very good news there, just in terms of keeping our operating budget in check. So we'll provide that in the next meeting. And then we will be starting our fee assessment for the FY25 period based on the new regulations that you just proposed. Probably having those go out, I think, early August. But then we'll also summarize our what we've received for FY22, FY23, and FY24. So we'll do that in the same report that we do the budget closeout. So you can expect those in September.
Okay.
Great.
Is there anything from the stakeholder council, Christina, you want to mention to the board?
I
Or
just
anything?
wanted to say the next meeting is August 26th. It's going to be at 2:00 PM virtually. And I also just want to mention the website to the people streaming in. There's multiple places that we are posting information on the website now. The homepage, we have a news and announcement page, and then there's a lot of information embedded within our page. So you should be able to see things more clearly now that we have the new website for deadlines and due dates. So just, make sure you're on the website if you have questions about our processes or timelines or anything like that. And that's mainly for the public, but I just wanted
Okay.
everyone to be aware of it.
I'm not very good at the websites, but just assume that I had trouble finding the 6 drugs and any information about the 6 drugs on the website.
That's helpful.
And so can we make that clearer?
Yes.
Yes, we will
we're-
make that clear. We do have a cost review tab, but we will flush that out and try to make
Yeah, I mean, I
that.
looked at that and I didn't see, Farxiga has this characteristics and whatever. So I mean, if the public is going to comment, they would need to have good information about the 6 drugs that we're looking at cost review.
Great, thank you.
Great, thank you.
Okay, anything else? Andy, you're good? Chair doesn't really have anything other than I'll commit to the board that we'll work with staff. We'll try to get some extra meetings in the fall and get the timeline out to us as soon as possible, so that we'll have a better understanding for where we're going in the fall. Let me go around the table first. Stephen, anything?
No,
You have
I
to
just want to keep moving along and, not keep reinventing the wheel. So it seems like we're doing often.
I don't think we've reinvented any wheel. That's
I know, or
I wish we had reinvented a
right.
wheel.
Or find the wheel.
If I could say anything to President Miller now, he'd turn over in his grave for calling me up about this job. Joe?
Sorry, no, nothing additional from me.
Barry?
Nothing for me.
Jerry?
No, I'm excited about the next 5 months. I think It's gonna be our best 5 months that we've ever had.
With that, I'll entertain a motion for adjournment.
Oh, so,
Move
so
to
moved.
adjourn.
Second.
We stand adjourned until our next meeting. I'll just,
To be determined.
thank you very much. Thanks to all the support we get from the Senate. Pass that along.
Okay, thank you all.